Hello everyone, I am Dr. SantoshKumar from the city of Joy, Kolkata. I am an orthopedic and joint replacement surgeon doing my work over here in Kolkata, and it's our endeavor that we bring to you the world-class orthopedic surgery at the most affordable price to you right here in Kolkata, and all of you are welcome to visit our city, Kolkata, and avail our orthopedic and joint replacement facilities. So we have been discussing several topics. Today we will be discussing about the hip joint. Well, the problems of hip joint are enormous, but luckily it is less common. Hip joint is the single most important joint in our body. A hip joint, if affected, can lead to incapacitation of a person. We all walk, run, swim, everything is modulated through the hip joint. Hip joint is a big joint. We have two hip joints on both sides, right and left, and it's a ball and socket joint. So where is the hip joint exactly? This is the hip joint, this is the pelvis, and this is the thigh bone. Thigh bone or the femur articulates with the pelvis, and that joint is known as hip joint. That's a ball and a socket joint. There is a ball and there is a cup. Now this joint, since it's one of the most important or probably the most important joint in human body, any affection of this joint leads to enormous incapacitation. Now this joint can be affected mainly by two ways. One is by fracture, which occurs mostly in seniors of our society, because these fractures are insufficiency fractures. These are osteoporotic fractures and they occur mostly in seniors of our society. Once a fracture of hip joint occurs, a person cannot stand and walk, and it's really incapacitating, and we have to mobilize the person, we have to treat the person with something like hip replacement, which will enable a person to move from the next day of the surgery. And it's very important for us to make the person move. Otherwise, a fractured patient, a senior citizen, once the person gets bed bound, person is subjected to many medical comorbidities and the condition starts deteriorating. So we have to do hip replacement and make the person move from the very next day of surgery if there is a neck femur fracture. So one condition that affects the hip joint is a fracture. Second condition that mostly affects the hip joint, is various kinds of arthritis. The word arthritis means destruction of the joint, the destruction of the ball and cup mechanism in the joint. That is known as arthritis. Now this arthritis is of two kinds. One is primary arthritis, primary osteoarthritis, which is age-related wear and tear. Fortunately, in India this is less common. In India we have more of knee arthritis, knee primary osteoarthritis. Hip primary osteoarthritis in India fortunately is less common. But there are other kinds of arthritis which are secondary arthritis, and those arthritis have a definite cause. For example, there is something called Ankylosing Spondylitis, which is a genetic disease. It is a disease which is transmitted in our genes by a gene called HLA-B27. This Ankylosing Spondylitis stiffens the whole spine, makes it a bamboo spine, and it fuses the hip joint. A person will have enormous pain in the groins, there will be a painful limp, there will be a distinct painful limp. It's very difficult for the person to walk with ankylosing spondylitis if it affects the hip joint. There is a pain to walk, and finally their pain comes at night also. There is pain in sleeping also. So this ankylosing spondylitis is a type of genetic disease which is quite common in people of Eastern India and Bangladesh. So we are here to treat you if somebody is having ankylosing spondylitis. Now other kind of hip arthritis that is quite common is avascular necrosis. What is avascular necrosis? It's a problem of blood supply of the femoral bone, femoral head, which leads to destruction of the hip joint. There are other kinds of arthritis like infective arthritis, like tubercular arthritis and etc. So whatever may be the cause of the destruction of hip joint, the treatment is replacement. The treatment is hip replacement, and hip replacement is the most successful surgery in medical science today if it is done meticulously, perfectly and precisely. The key word is meticulousness, perfection and precision. So these are the key words. So having a look, these are the types of fracture of the hip joint. One is intracapsular fracture, which affects the neck of femur, and it is inside the joint. This fracture in osteoporotic bone, if presents late, is generally replaced, and if the fracture is outside the joint, it is fixed. This is known as extracapsular fracture or trochanteric fracture, and it is fixed with hip screw and plate. To see these fractures, we have to do an X-ray, and in X-ray we can clearly see if which side is fractured, whether it is type of intra-articular fracture or whether it is type of extra-articular fracture. So X-ray is a basic investigation as far as hip pathology is concerned. Of course, MRI is there, which has to be done in initial stage for classification of arthritis, especially if it is avascular necrosis. MRI is very important to classify the arthritis. So similarly, in our various kinds of arthritis of hip joint, in X-ray we can clearly see that there is decreased joint space, there is sclerosis, there is distinct whitening of femoral heads, which is known as sclerosis, and these things can be definitely seen in X-ray. And if you want to pick up early, we have to do MRI. MRI leads to early picking up, and sometimes several times we have to do CT scan before surgery for proper planning of our surgery. So that's also an essential investigation modality. And in X-ray again we can see here that hip joint is arthritic. Another X-ray which I will show you, this side is the normal hip joint, this is a circular hip joint, and the cup is congruous. The cup is congruous with it, and that is beautiful geometry which is there. And this geometry is disturbed over this side, in left side, which is arthritis and incongruous hip, and there is sclerosis and destruction of the joint. So to treat this, we do something called hip replacement. Hip replacement generally means total hip replacement. Sometimes it can be partial hip replacement if a person is not fit enough for total hip replacement, which is known as hemiarthroplasty. This X-ray shows a partial hip replacement, which is known as bipolar hip replacement. So this is also an option, but generally it's total hip replacement, and this is how total hip replacement looks like in an X-ray. To understand total hip replacement, like this is the implant of total hip replacement. There is a cup. Like natural hip has got a cup which is known as acetabulum. So this is a cup. Outside is metal, inside is ultra high molecular polyethylene or plastic. So this cup can be, all implants can be cemented or uncemented. This cup can be put with bone cement or without bone cement. This particular cup is an uncemented cup. If it is a cemented cup, then it is made only of plastic. There is no metal lining in it. It's only of plastic. Then cemented cups are only made up of plastic. Similarly, this is the head, this is the ball and cup joint, this is the ball, and this is made up of two kind of material. One is cobalt chromium and ceramic. Both of them are equally good. It doesn't matter which one is being used, because everything depends on the surgical precision. Of course, ceramic is costlier than cobalt chrome, but as far as results are concerned, all of them are equally good, because the most important factor is the surgical precision, the mechanics, the geometry, and it is not the material. So the reason why cobalt chromium or ceramic is used is because cobalt chromium can be most highly polished. Titanium cannot be highly polished. So this stem is made up of titanium. This stem is made up of titanium, and this stem, whether it be stem or the cup, this can be used in a cemented. There are cemented designs, there are uncemented designs. The uncemented designs are made for press fit. They are coated with calcium hydroxyapatite, and they are rough in their texture. It's press fit, so that bone engrows on that. And if it is a cemented stem, then normally it will be highly polished. It will not be rough and press fit, it will be highly polished. Decision to make cemented and uncemented is based on the quality of the bone. If a person is younger, physiologically younger, and the bone is of good quality, we prefer to opt for uncemented implants, because they are press fit and bone engrows on that. But if bone quality is poor, and in certain conditions where there are other conditions maybe there which may make a surgeon to shift from uncemented to a cemented implant, if the bone quality is poor or other factors are there, we have to several times use cemented implants. Both implants are good. It's not that one particular implant is good or other implant is bad. It's not like that. Most important is the correct decision, correct technique, and correct precision. So both these implants are good. And this is how it looks like in an X-ray, a total hip replacement. As you can see on the left side, this is a total hip replacement. What are the components of total hip replacement? We just saw. This is the cup, and it has got a liner. This is the cup made of metallic shell, and this is a liner, plastic liner inside it. This is the femoral head. This is the femoral head which you can see, and this is the stem. So these are the components of the total hip replacement implant. Sometimes we use a dual mobility cup also, which you can see here. There is a dual mobility cup, and uncemented stem can be proximally coated design, that is half coat, superiorly coated or fully coated design. Both have their own pros and cons. It's more of a decision of the surgeon which implant to be used. And hip replacement or any joint replacement can be done for a second time also. That is known as revision hip replacement. Whether it be hip or knee, it can be done for a second time also. That is known as revision joint replacement. Revision hip replacement is also possible if for certain reasons, maybe it's after 30, 40, 50 years it has to be redone, or whatever reasons it's redone, it can be redone for the second time also. That is known as revision hip replacement. The implants are slightly separate, the stems are longer, the cup has multiple screw options. So all these options are there. We have been routinely doing hip replacements almost daily in our city, and if a person needs both hip replacements, we several times do both hip replacements in the same sitting, or let's say most of the times we prefer to do in same sittings. That is known as bilateral simultaneous hip replacement. That allows a person to regain mobility faster rather than undergoing two surgeries. It's better that a person undergoes one surgery and both sides problems are solved. So it's better than undergoing two surgeries, because the walking becomes normal only if both hips are normal. If the problem persists in one hip, then it's difficult to walk normally. And doing simultaneous in the same sitting also cuts down the cost, although that is highly secondary. Most important thing is that the person recovers completely in one surgery. We have been doing both hip replacements in a single sitting, and the person walks from the very next day of surgery. Like if we do surgery today, from tomorrow we will make the person walk. First few days we need a walker or a support to walk, and the person starts moving normally after couple of weeks, and after 3 to 4 months, a person can start jogging also, person can start playing non-contact sports also. So hip replacement is a very life-changing surgery for people who are incapacitated because of hip problems. It's a very predictable surgery. Of course, the surgeon, the surgical team, the surgical technique are of paramount importance and more important than anything else. And as the World Health Organization has claimed and told that hip replacement is probably the most successful surgery in medical science today, and we in Kolkata are providing you the world-class hip replacement surgeries at the most affordable price. In case of any need, please do approach us. I am Dr. SantoshKumar. I am a orthopedic and joint replacement surgeon in Kolkata. You can WhatsApp me on my WhatsApp number 9831 911 584, or you can mail me at santdr@gmail.com. I have been doing joint replacement since last 15 years, knee and hip, both of them, and generally I prefer to do both knees or both hips together in same sitting if both of them are needed. I have been doing my surgeries at various hospitals in Kolkata. The most common of them is Belle Clinic, Woodlands Hospital, and certain other hospitals. My clinic is in Lake Town, Kolkata, which is very conveniently located in front of the VIP road near the airport, and it is very much approachable from the airport as well as from the railway station of Kolkata. Please do come here. I can assure you that with us you will get the world's best and the safest at the most affordable price. We have been using whatever is the latest in joint replacement, whether it be hip or knee. We have been using the world's most advanced computer navigation system called Orthopaedic. We have been using the international implants which are made in US, and the ones which are available for the best for the US citizens are available right here in Kolkata to you also. We have been using implants made in US and Germany, and they are all international implants. And you will be surprised that with the quality of care, with our expertise and experience, which amounts to more than 10,000 joint replacement surgery, still it is the most affordable, one of the most affordable on this earth, what we are providing you, and best in quality. Thank you.